right, thank you guys for joining us tonight. We are going to talk about executive functioning and physical fitness and how those two connect and are intertwined. I am Dr. Corinne. I'm the owner and director of PHYT Learning Cleveland, and Dr. Nick is here, who's the owner of PHYT For Function, and we'll talk a little bit more about his background and what he does. I'm going to start us off tonight by talking about how we define executive functioning skills, give some examples of everyday tasks and behaviors that require these skills, and then touch just a little bit on how the research over the past few years has really highlighted the importance for children and adults alike to have these set of skills. So a little bit about myself. Like I said, I'm the director and owner of PHYT Learning Cleveland. For those of you that aren't familiar, PHYT Learning Cleveland is an intensive and specialized academic skill building program. We work with learners of all ages and ability levels, and our evidence-based curriculum produces 1 to 2 years growth in 40 hours of instruction. And towards the end of the presentation, I'm going to talk a little bit about our logic curriculum, which addresses specifically executive functioning skills. I have over 15 years of experience in education and applied behavior analysis. I started in the field as a school psychologist and worked in a variety of settings. And then about 4 years ago, earned my Ph.D. in applied behavior analysis. And during that time is when I found PHYT Learning and decided to open a lab about 3 years ago. So I'm going to start us off by talking about executive functioning. So executive functioning is often referred to as the chief operating system of the brain, but there isn't an agreed upon definition for the term. So depending on who you're reading, you're going to see different terms for executive functioning. So it's most often, and I think most clearly, just used as an umbrella term for a set of processes or sub-skills that are needed for higher level cognitive functioning. Sometimes some of these skills people think of or refer to as self-discipline or self-control, but there's a lot more to it than just not having self-discipline or having self-control. So this graphic shows just a few of the skills that fall under executive functioning. So we have that working memory, which is that short-term memory, being able to take something in, process it, and then produce it back out in some meaningful way. Prioritizing, organizing, sequencing, managing your time, attention, and initiating tasks, focusing. There's a lot that falls under that social, emotional, and impulse control category. And then communication, cognitive, flexibility, and shifting. So literally all of those cognitive skills that we use every day fall under executive functioning. There is a great book out there called Smart But Scattered. It's one of my favorite resources for executive functioning. I think she actually has a series now. This is the original one. It's for children. I think there's an adult one now. And then they have a guide to success for executive functioning, all great resources. If you or somebody that you work with or your own child has difficulty with executive functioning skills, there's lots of good interventions and strategies in those books. But she breaks it into 2 different categories, and I like that the way that they break it up. So they have 11 sub-skills. They have one category of skills that involve thinking, so the more of those cognitive skills, and then another one that has skills that are involved doing or behavior. So as somebody who studies behavior, I like the way that this is broken up. So we have all of those same skills that we talked about under the umbrella, that response to inhibition, so being able to have some of that impulse control, that working memory, that emotional control that's going to go with that response inhibition. Sustaining attention, so being able to start a task, which is the one under it, that task initiation, but then also being able to sustain attention throughout the task, and then planning and prioritizing the tasks or the task that you have at hand. And then we have the skills that involve behavior. So this is organizing, not only time management, which is directly under it, but organizing our physical space. Being able to set goals and then know how to reach those goals, having flexibility. So that cognitive flexibility is kind of being able to think on your toes, kind of roll with the punches. And then that metacognition really falls into that problem solving, and not just as we think about problem solving with math skills or brain teasers, but also life problem solving. So what does this look like in everyday life? I've just given a few examples here for different grade levels. Obviously, if you just sat down and wrote out every task you do during the day, and then think about all of the executive functioning skills that those take. So for students who are in kindergarten through second grade, we would expect that they'd be able to put their toys away into assigned spot. So that's not to say you can just tell them to go in their room and organize it or clean it. That's probably too broad of a direction. But if they know that the puzzles go on the shelf and the stuffed animals go in the bed and the clothes go in the closet, they should be able to independently go in there and put their toys away in assigned spots. Students or children that have some deficits in executive functioning may have more difficult with that task. Being able to bring papers to and from school. So being able to know that you have a paper that has to go home, put it in your folder, put it in your book bag, it safely makes it to mom or dad, and then it's back in the folder, back in the book bag, back to school. Following safety rules, being able to retell your daily activities. So I think it's important to emphasize here that this can be a can't do versus a won't do. So your student comes home from school and you say, how was your day? What did you do? And they say nothing, right? That's more of a choice not to tell you about the day. But if they're interested in it or you get them to tell you, can they tell you some of the details of the day? And do they tell you in the sequence that they happen, or are they kind of jumping all over the place? And that last one is sustaining attention to complete a chore or a short assignment. So then we move into grades 3 through 5, and we're expecting a little bit more advanced cognitive functioning here. So being able to keep track of their belongings when they're away from home. So when they go to their friend's house, are they able to come home with everything they left with? Do they have their coat? Do they have their backpack? Do they have their cell phone or other electronics? Being able to plan out some simple school projects. So they have a book report and they're able to independently complete that and manage their time around how long that's going to take. And then their inhibition and self-regulation. So they may be upset, but they're able to refrain from having a temper tantrum. They're able to wait. If they're at the doctor's, they need to wait for an appointment, or if they have to wait for mom to get off the phone before they can ask her a question, that they have some of those skills in those grades 3 through 5. And then as our students get older, we're just looking for more advanced skills. So being able to focus on homework for 1 hour to 2 hours with short breaks built in there, and being able to know when they need those breaks and taking them independently. Being able to organize their schoolwork and assignments, following school schedules. So we get into middle school, you might, most students start having multiple teachers with multiple classrooms, so being able to follow that schedule. Just being able to start planning their time. They're starting to have more schoolwork, they have activities, they have chores, being able to do some of that time management, planning out longer school projects, and then that self-control, that impulse control to inhibit rule breaking in the absence of an adult or a teacher. A lot of the times, children that have some deficits in executive functioning are more likely to engage in dangerous and risky behavior. So we know from the research that there's specific diagnoses that are often associated with deficits in executive functioning skills. By no way am I saying that everyone with these diagnoses has deficits, or that people that don't have these diagnoses don't have deficits, but the research is pretty strong in these areas. So autism, specific learning disability, ADHD, emotional behavioral disorders are highly correlated with deficits in these executive functioning areas, which means that oftentimes they're going to require more explicit instruction in some of these skill areas. So why are these so important? So I think that's pretty clear just based on what we've talked about, how you need these in your daily living. But again, there's several studies out there. I have not cited my research here, but if anyone is interested in this research, I'm happy to send it to you. Several studies have demonstrated a link between executive functioning skills and academic success. So individuals who have higher levels of executive functioning are more successful academically across the board, elementary, middle, high school, and beyond. Executive functioning skills are also linked to social skills. And there was a study recently done that showed individuals that have higher levels of executive functioning are more likely to complete higher education. They have a higher earning in their lifetime, and they are more likely to have successful adult relationships. And unfortunately, there's a lot of research on the other side that shows that individuals that lack these skills are more likely to have poorer outcomes later in life. for physical health, substance dependence, social emotional status, and kind of across the board. So these are really important skills that we build in our learners when they're young. Okay, so I'm going to hand it over to Nick, and he's going to talk a little bit about how you can help your learners build some of these skills by being physically active. I'm going to stop share. You should be able to continue share.
All right, thank you, Corinne. And let's see if I can get this pulled up here. Oh, we're not going to learn how to needle today. There's the one I want. All right. It is good to know that the refraining from a temper tantrum isn't a skill until grade 3, because my 2.5-year-old does not have that down. I'll tell you that.
Yeah, don't expect too much executive functioning for a 2.5-year-old.
It does not exist. It's too funny. All right, so thank you. Yes, so my name is Nick Sanders. I'm a physical therapist, and we have a small local company called PHYT For Function. We really focus on a lot of the manual therapy side of helping people and kids with pain, usually orthopedic things, you know, your back hurts, your neck hurts, you hurt something while you're playing a sport or whatever. But being so heavy into the manual therapy side, as you briefly saw, I teach dry needling courses and cupping courses, and some of these hands-on therapies really took me down this journey of understanding inflammation, because most of our manual therapies are an inflammatory thing. And when you start looking at inflammation, now you start seeing connections between exercise and inflammation, and then inflammation in brain health, or inflammation in gut health, and all these different things of these connections. And we've really tried to tie down and kind of bring together, you know, what are the roles of inflammation? How does that affect the way we feel? How does it affect long-term health? And as you're going to see here, hopefully shortly, is some of the brain development things. So pretty fascinating arena, and roundabout way that I got there, but it's something I'm very passionate about. I do have 2 little kiddos at home, and so the more I talk to Corinne, the more I kind of think about, all right, what do we need to do to make sure, you know, we're getting some of those skills for our children, and as they develop, you know, that stuff becomes more and more and more important. So what I want to talk about primarily is the relationship between exercise or physical activity and cognition, and executive function and brain development, all those kinds of things. I think there's a general assumption that exercise is good for us, but why? You know, what does it do? Does the research support that in looking at brain health and executive function? And then how do we apply it, right? I think we all know exercise is good, yet we're doing less and less of it as a country, and as a nation, we're seeing less and less physical activity. So it's one thing to know it's good for you. It's another to figure out, well, how do we actually apply that to ourselves and to our children? So we look at the research, and I could have cherry picked, you know, multiple studies here. So I just pulled a meta-analysis, which they grabbed the best of the best studies, and looking at positive effects of physical activity and executive function. And, you know, I think they showed both short-term and long-term improvements. When you increase physical activity, executive function measurements improved. And because this was a collection of studies, they looked at different components of executive function, as Corinne had noted. They also used different exercise modalities. Most of them were cardiovascular, so treadmill, bike, those kinds of things. The best improvements were when we had longer term programs, right? So if we can keep people physically active for longer periods of time, you know, that's better than just a short burst type of a thing, which I think makes a lot of sense. But if long-term exercise is important, we need to make sure it's feasible, right? So that our children can continue to do that for the long term. When we look at immediate effects, and this particular analysis, meta-analysis here, they included studies that looked at children with different disorders as well as children without disorders. So, and both were showing positive effects, which I think is important, that we're looking at, you know, both sides of the spectrum there, if you will. But improving attention to target stimulus, looking at processing time, anticipation of results were better, goal-directed behavior improving, academic performance. So multiple measurements. And then children with long-term exercise habits, even seeing changes in brain development. So greater white matter development in the brain when they look at it directly, activity patterns changing, and then still seeing those executive function changes over time. So in my mind, if we can keep our kids more active, it may actually help development of not only these skills, but also the way their brain actually forms, which is a super powerful thing. Kind of along that same road, programs that extend several weeks are going to have the greater effect. So we want to try to find something that is, it's one thing to go out and exercise for 3 weeks, but how do you find things that they can do consistently and repeatedly with busier and busier schedules, right? Between the demands at school and, after school activities, parents, single parents or parents that are working 2 jobs, how do you fit it in? How do you find that? This was a pretty interesting just quote from the conclusions, but look at 26 different studies and found that, evidence of physical activity inducing changes on neuroimaging. So looking at the brain itself, looking at the way that person not only functions, but their brain develops, just underlying that importance for physical activity for kids. And I think we just need to find a way to do that. The other thing that, kind of being on the sideline as a physical therapist, you meet kids in different settings. Usually they hurt their knee or they hurt their back, but the number of teenage and younger children on some type of antidepressant or anti-anxiety type medication is just astounding to me. And we know in adults that exercise is probably more effective than some medications at reducing anxiety and depressive type symptoms. And here's just another study looking at physical activity in younger women, 22 to 21, with sitting. They surveyed over 9,000 women. They followed them for 12 years. Any physical activity, any exercise was able to negate or reduce the risk of depressive symptoms. Anything, didn't have to be anything special, just anything over their normal activity. And the risk of depressive symptoms increased when the sitting periods increased. So if they, they're surveying them, but if they said they sit for more than 10 hours, that was the greatest risk of developing depressive symptoms. That's a big stat, right? Especially when you look at technology. And our daughter, for the first time last night, turned on the TV by herself, scrolled to Amazon Prime, went to the kids section, scrolled to her favorite cartoon, turned on her favorite cartoon by herself, didn't say a word. She would sit there for hours, right? And she's 2. So that habit, that developmental thing, it's easy, right? And as a parent, it's easy to kind of, okay, go watch TV and you can do whatever you need to do. So there's just so many challenges.
Nick, can I jump in there?
Yeah.
That just makes me think about COVID and how much we were sitting during
Yeah.
COVID and kids were sitting online, and then how much kids are sitting in school. There's several schools that have taken away recess.
Yep.
So
Because it's not on testing standards.
Yeah. And that's an astounding statistic. I didn't know it was that high. That's crazy.
Yeah, it's pretty interesting, right? Because of what we've prioritized. And then outside of the brain and the depressive side, the posture things that we see in the clinic, I have so many 9, 10, 8-year-olds that can't touch their toes, can't squat down. Like if they're going to do a squat kind of position, they just can't get there because their body is just so not used to being in those deep squat, deep seated positions. And, we can argue about genetics and this and that, but the reality is most kids, when you start talking 3, 5-year-old, before they get into school where they're sitting all the time, or they get into scenarios where they're using a lot of technology, they don't have any issues sitting on the floor, sitting in a deep squat. They can play there for a long time. So I think we need to also consider the postural effects. And then because they don't have that movement, do they use those ranges of motions? Does exercise become less fun? Physical activity become less fun because they're not good at it, right? It's a difficulty thing. So I think there's multiple layers there. And this study from the Journal of Orthopedic and Sports Physical Therapy really kind of highlights the effect that there are no necessarily bad postures. There's no dangerous things. We should all be able to bend and lift and squat and sit in any position we want. It's not that sitting's dangerous inherently, but if we sit there for a long time, our brain just wants us to get good at what we do a lot of. So if I sit a lot, I'm going to get very good at sitting. The skills that make me good at sitting are stiffness, right? I want to be stiff so that I can hold that posture for a long time. So being good at sitting is not going to correlate to being good at running and jumping and squatting and playing like kids should be able to play. And so I'm not concerned about what position our daughter sits in, as long as she gets out of that position frequently, right? We want to make sure that our kids aren't staying in one posture or position for a long time, right? I don't want to be flirting with that 2, 4, 6, 8 hours of sitting in a day. I want to be moving as much as we can. And when she wants to sit and watch TV, that's fine. We just don't want to do it for 10 hours at a crack, right? That's kind of the big key. And we want to make sure that we're moving in ways that aren't necessarily seated postures or sitting. And again, just this idea that prolonged sitting, multiple research now looking at cognition and health and what happens when we're taking in sedentary behaviors. And this goes for kids as well as adults. One of the functions may be inflammatory. And again, this is definitely a passion of mine, but there is research out there looking at when we exercise, get some type of physical activity in, it creates an inflammatory response. Exercise is really a stress. That's why we all avoid it, because it's a stress to the body. It's a stress, but when we create inflammation from the stress, our body reacts with an anti-inflammatory cascade, which should result in a net reduction in inflammation. There is also evidence out there now that when we're in sedentary behavior, it may increase the permeability of the blood-brain barrier. So the blood-brain barrier is this thing floating around your brain that keeps inflammation and bad things from the bloodstream to get to the cerebrospinal fluid or the fluid that's floating around your brain. Exercise may help make that barrier more, or I should say less permeable, so that inflammation can't get into the brain. We know different neurodegenerative diseases and different things along those lines. Fibromyalgia, we're starting to see where there's increased inflammatory markers floating around that fluid around the brain. That's a game changer type thing, right? If we got inflammation floating around our brain, what do you think that's going to do to nerve excitability, to anxiety things, depressive things, pain sensitivity for that matter? Powerful kind of stuff here. And we know that exercise can help reduce some of those effects. So we need to find a way to build that in. We know all these things. I think it's pretty commonplace knowledge at this point. Yet we're still seeing a decline. We're still seeing a decline in physical activity in both adults and children. This data from Halal in 2012, they estimated that only 1/3 of adults reached the recommended levels. I'd be willing to bet that it's worse in 2022 than it was in 2012, right? Because COVID, because of technology, schools are shifting online. We're doing Zoom calls online, right? There's just more and more ability to sit. I think there's also more and more barriers to sitting. You can get into a lot of different things. This particular research looked at, the interaction between the parent and the child, right? I can tell you when my exercise habits are better, our daughter is doing more things, right? If I'm playing outside, she's playing outside. If I'm in the house doing squats or getting on the bike, she's going to want to ride her bike or jump on her trampoline or do her steps or whatever it is. She's going to, they mimic everything. And so they're going to take on some of those activities to some degree. That is not the be all end all, but I think it's certainly one thing to kind of consider is your parent side of that. The other things are, safety. Can you let your kid play outside, right? Do you live in an environment where you could let your child go to the playground or even play in the front or backyards without being concerned? We used to ride our bikes around the block and we used to go to friends' house and play all day and those kinds of things. I'm not super excited about letting my daughter ride her bike around the block, right? Like it's a thing. So I think some of the socioeconomic and some of the different things out there from a safety standpoint are certainly barriers to physical activity. And then just environment, what's around? Are there playgrounds accessible? I look at the ones kind of around us and they're accessible, but they're packed, right? There's a million people at them. There's less parks and open fields for people to kind of go and play at. So all of these things kind of factor into this. How do we keep our children active? And just kind of intrinsically, as the adult, how busy are you, right? Like you got 10,000 things. Can you get your kids to these different activities, or how do you get them involved in different things? So again, we're talking about children mostly here, but looking at adults, again, no significant increase in the percentage of individuals adhering to the guidelines. So we're seeing more and more of this sedentary behavior, both kids and adults. We got to figure out a way to get into those models. And I think this idea of getting comfortable with being uncomfortable, you see this quote coming from different people, but exercise is a stress. It's not exactly, for some people, it's not exactly the most fun thing in the world because it is a stress to the system. It's hard. It's easy to make excuses of why you're not going to get it in. But the cool part is when you start exercising, you get stuck in a positive exercise link. So this research from 2019 showed that when people exercise, they have higher levels of executive function. So they make better choices. They plan their day better. They do all of those things, and they're more likely to stay in an exercise routine. It's easy to get out of a routine where you just never want to go back to it. But then it's also easy once you're exercising, like you kind of crave it, right? You want to keep exercising because you know how it makes you feel. You feel sharper, your brain's working the way it's supposed to. All those kinds of things keep you exercising. We just got to figure out a way to keep people in those habits, right? And again, we see that improvement in executive functions. It's going to be easier for you to kind of take charge of those things. When we look at what adults and kids should be doing, there's specific guidelines that you can make adaptations and plans for specific scenarios, but I think our physical activity guidelines for Americans is probably a great place to look. When you look at adults, cardiovascular, moderate intensity, aerobic activity, anything that kind of makes your heart beat faster, right? And I usually define this as something where you're at least, if somebody's talking to you, they know you're doing something, right? You can talk to them just fine, but they're like, what are you doing? Why do you sound weird, right? Your heart rate's up enough that your breathing's up just a smidge, that you can still talk, but people are like, okay, you doing something? We want to get into that range at least, right? And that 150 minutes a week is a good target. 30 minutes, 5 days a week, not too crazy. There's also plenty of research now that doesn't need to be a continuous block. So even breaking in 3 minutes or 5 or 10 minute blocks into your day can be extremely helpful at blood sugar management, looking at different measures of cardiovascular health. Just 3 minutes of increasing your heart rate can be a huge thing to controlling blood sugar. So kind of cool stuff. And then adding muscle strengthening activity. This is probably being strong and having higher muscle mass helps you absorb blood sugar and keep your blood sugar down, which reduces inflammation and has a lot of other factors as well. But there's probably an inflammatory function to both of these things. And having a net anti-inflammatory effect is, I think, a major part of why exercise keeps us healthy. So very important there. For preschool age children, age 3 to 5, play, right? Let them play. Get on the floor, bounce, roll, jump, do steps. I dare you to try to mimic what your 3 to 5 year old's doing and see if you can keep up. I think there's a hilarious James Corden video on YouTube somewhere where he tries to mimic these kids as they're rolling and playing on the floor and doing different things. So it needs to be fun, right? If it's not fun, they're not going to do it. So play with the kids, get on the floor and play with them, roll around, roll balls, whatever it is, right? Just try to play and see if you can keep up. I think that's the good for your mobility, good for your mobility to see if you can get on the floor and do those things. Now, as kids get older and they get into school, there may need to be a little better plan because you've just taken up whatever, 6-7 hours of their day into a seated posture. So now to hit different guidelines, you may need exercise to kind of make up for that other structure that's kind of been placed into their day to pick up some of those things. So we can start to add more aerobic activity. We can start to add some strengthening type things to see that muscle and bone development that we're looking at as children get older. And I think that's very valuable. Exercise, I think, is a way to make up for or kind of pick up the slack from some of the other things that we do, right, is kind of how I look at that. A lot of times when we start talking about kids, especially prepubescent, the question comes up is it safe? Is it safe to do strength training and different weight-bearing exercises with kids of that age? This is actually slides from a presentation I did in my undergraduate education. So when I was in college, I coached junior high football for, 7 years all the way through school. And I was in charge of the weightlifting program. So it was something I became very interested in coaching kids and what needs to be different for kids versus somebody with a higher training history, like an adult or even a high school athlete. And I think it's very important that the instruction takes priority and it needs to be fun. So the program needs to be something that's designed for children, right? You don't want to take the article from Men's Health or Women's Health, be like, oh, this is a great bodybuilding program. Here, 10-year-old have it. That's not what we're trying to do here. We are trying to get them in that habit so they make better decisions. So if their executive function improves, they make better decisions with exercise and things moving forward in life. That's one of our main goals. We have to make sure that you have the instruction and the coach that's there that can teach them the proper technique, the proper movement patterns, looking at the principles that are there, and making sure that we're progressing kids gradually. Most of the adaptations or the gains that a child is going to see with exercise, some of it's hormonal, but for most of those children that haven't reached puberty yet, that's going to be a pretty limited effect. It's more a motor learning. Their brain is going to learn how to activate the muscles with the right timing, with the right sequence, so that they can generate more force. So we're really looking at nerve development and motor patterning development. So the scheme of how you're going to exercise a child is very different than how you're going to exercise a 25-year-old, for example. So we need to make sure we're really following those sound progressive overload patterns where the nervous system has a chance to adapt, and we need to make sure it's fun, right? And again, we're not really looking at building huge muscles for our 10-year-olds. We're looking at just teaching them how to learn, how to move, and how to play. So we need to create enough stress to create a change, so something reacts, but not so much that we put anybody at risk. Whether we're talking exercise, we're talking manual therapy, after doing a podcast with Corinne, where we're talking learning, you need enough stress, enough stimulus to kind of create an adaptation to where your brain wants to learn how to do that, right? I need to be able to do that. And then that stress builds. Your body's going to release a response to that stress, hormone, immune, inflammatory, different growth factors. All those things are going to happen, and it's going to hopefully build it stronger, right? So that you get gains in performance. If you overwhelm the system, and again, I don't care what kind of stress it is, whether it's exercise, it's life, it's lack of sleep, it's poor nutrition, psychological stress. If we don't allow that recovery to occur, then we end up overtraining, right? We end up kind of breaking down because we don't have that recovery period where we can build things back stronger. So we're looking for that sweet spot of enough stress to kind of get the body moving, to make sure we're not adapting to sedentary and seated postures, enough stress to create a change, not so much stress that we overwhelm the system, right? And I like using the term, the immune system has to win. Right. So when I add a stress, whether it's something I do with a manual therapy technique in the clinic or it's an exercise prescription, it's enough stress to elicit a change, not so much stress that your system's not going to win. Right. We're always looking for wins. So what we want to make sure of when we're looking at physical activity for children, make sure that they're getting something. I don't care what it is, something that elevates their heart rate, that they're playing, that they're changing positions often. We do not want sedentary behaviors for multiple hours at a time, and certainly not a total duration during the day, as best as we can prevent it. But we need to be able to change positions and then play and exercise in postures and positions that are different from sitting. So we don't want to necessarily sit all day and then hop on a bike and just stay on the bike all day, right? You're just sitting in the same exact posture for a longer period of time. So try to play and move in ways opposite of where you're spending your time when you're sitting. For our clinic specifically, or if you're not from around the Cleveland area, finding a physical therapist that can help, or a really good strength coach that can help addressing previous injuries, limitations. Again, I'm seeing that at younger and younger ages now. We're working with kids that are 6 and 7 and 8, which is quite different. But making sure that you can address some of those things to avoid injuries that may have occurred in the past, or address pains that may be there. And then, our main goal, our overall goal, is to just help people stay healthy and address small things before they turn into big things. We don't like treating catastrophe problems. We like treating like, my neck feels a little off, or I'm having trouble getting into this position. How can you help me get into this position? That's really where we like to play, if we can help it. So I'm going to turn it back to Corinne so she can kind of talk more about the learning side. But if I can leave you with anything, it's just find a way to just little blocks. It doesn't need to be a huge habit change initially. It can be little tiny things. Find 3 minutes, find 5 minutes. And the more you do that, the more consistent you are with that little habit, you'll make better decisions, executive function patterns improve, and hopefully make better decisions moving forward. So let's all try to take a little, find a way to get some exercise built in, and hopefully combine that with some high-level learning and get better kids out there. All right, Corinne, I'm going to turn it back to you. I'm going to stop sharing here.
All right. I am going to go back to sharing. Give me 1 second. Here we go. So you said something there that I loved and I wrote down because it's exactly our philosophy. I've just never heard it said the way that you said it. And that was the brain gets good at what it does a lot. So that is part of our programming here at PHYT, is that our kids come 4 to 5 days a week for all of our instruction. So whether they're working on the executive functioning skills or they're working on reading or math, they're here 4 to 5 days a week because we want them practicing more days a week than they're not, or more times a week than they're not. So just like going to the gym, right? We have to do that more days a week than we're not to see the progress. And that's how you learn and become better at everything. So brain gets good at what it does a lot. I really like that. I'm stealing that from you. So thank you for that. So at PHYT Learning, we have our PHYT Logic program. And it's really a catch-all for all of the skills that we were talking about as far as executive functioning. And it's my favorite program. I'm partial, I did my dissertation on this program, but I feel like everybody can benefit from this program. When I have a learner come in and we do an assessment for reading or for math, I always like to also do a logic assessment, because if you don't have these basic skills, you're not going to be able to be successful in any of the other areas. And it really focuses on executive functioning. So our first piece of this program builds on the prerequisite skills needed for executive functioning. So in order to be able to follow directions, you have to understand sequencing. You have to understand spatial relations. If you tell a student to go into the classroom and turn right and hang up their coat under the cubby and put their lunchbox over the cubby, and they don't know what under, over, left, right, any of that means, they're going to have a lot of difficulty. So we have to make sure that they have all of these, we call them tool skills, but these prerequisite skills needed for this higher level. So this program focuses on relating, comparing, contrasting, following directions, sequencing, classifying, all of those skills that we need at that lower level. We then build fluency into those higher level skills. So we work specifically on problem solving, we work on that working memory, reasoning, and critical thinking. And then that cognitive flexibility, so that being able to think on your toes and problem solve, that a lot of learners with those diagnoses we discussed earlier often have trouble in that area. We're also building confidence in our learners, and we're helping build that endurance and stability. So as you're practicing, you're able to do those different activities for longer periods of time, and you're able to do them under distraction. And that's really what we're looking for to build here. So I've also included here some resources on executive functioning. That first box is specifically if you are looking to build these skills up with somebody and you want to provide reinforcement, how to do that together. So anytime we're teaching a skill, we want to follow up with reinforcement, because in order for us to want to repeat something, there has to be something good that we're getting out of it. So that's what those first three studies look at. The next one is self-management. So some of those higher level skills that we're talking about, planning, organizing, time management, those are some great resources. And the last one is specifically teaching these executive functioning skills. So I mentioned the Smart But Scattered. I think that is a fabulous resource. We also here at PHYT Learning, once a student has those prerequisite logic skills, and sometimes occasionally we'll have a learner who comes in and doesn't need our programming on that, they have those basic skills, they really need to focus on that higher level of time management, planning, and organization study skills. So we actually use an executive functioning curriculum from Rush Center Hospital in Chicago. So this is also a great resource. And then my last one is it's the second to last one here. And this is for all my behavior analyst friends. This is written by a behavior analyst, and it's looking at teaching executive functioning skills using the science of behavior, and specifically for students with autism and attention disorders, but the strategies work for everybody. So those are just some of the resources out there. If you're thinking, wow, this really describes my child has some deficits in this area, looking into some of those resources, and then obviously getting them up and getting them moving is gonna help greatly in that as well. So I think everybody has our contact information if they signed up for this or if they found the link otherwise. So I think I can speak for Nick when we're both happy to talk with anybody that has any questions on these topics.
Yep. Thanks for having me, Dr. Corinne. That was fun. Good follow-up from our podcast to actually get some really cool info. So
Right. All right.
see you on the next one.